Hi there, my name is Jamie Scannell. I'm a cognitive behavioural psychotherapist working for Goldsmiths Counselling Service. I'm here today to share with you part 2 of our introduction to panic. Hopefully you've watched part 1. This is going to be the second part of that, so welcome. What I wanted to do today is just start with the aims, so how we cope with panic. So what I wanted to do is talk through how we cope with panic and its related symptoms. So this is whether you're experiencing some panicky feelings, perhaps you've had limited symptom attacks, or perhaps you've had a full-blown panic attack, which can actually be very, very scary. So this is, of course, going to be from a CBT perspective. So the first thing I wanted to talk through is just some cognitive strategies. Then also we're going to move on to attentional, physiological and body strategies before we finish with some behavioural strategies. I'm also going to maybe signpost a few websites and things like that. So, because there's general strategies and tools out there, obviously through mediums such as YouTube, there's loads of great videos about how we cope with panic. And there's also fantastic self-help websites, so such as Get Self-Help, psychology tools. These are great for materials and worksheets, things like that, ways of understanding ourselves a little better. So the overarching theme here is I want to try and help you retrain some of your thinking around this, but also ready your body for the challenges that panic can bring. I can't promise you won't feel panic. It's a feeling. Feelings are there for a reason, but perhaps in the future you might feel more confident in navigating the scary experience of panic with some tools under your belt, perhaps a few more weapons in your arsenal. Remember that panic is scary, but it can't actually hurt you. So let's start with those 3 modes that I've just talked about there of how to tackle the problem of panic. The first way is through our cognitive strategies, so that's how we think about panic and our cognitive understanding of panic. So what I'm to do is maybe help you restructure some of your thinking around how you perceive panic. I'll also share a particular strategy on this called Theory A, Theory B. Secondly, just talk a little bit about how we attend to panic, so where our attention is, our attentional focus, and maybe talk about how we can kind of train and retrain ourselves in this experience, because perhaps our attention can be modified in order to manage the feeling better. And the third mode is through exposure. So this is a behaviour-based strategy. So exposure is often used for the treatment of anxiety disorders. So this is inclusive of panic and panic disorder with or without agoraphobia. So let's just start with this quite nice quote from Paul Sarkovskis, 1996. The most effective way of changing a misinterpretation is to help the person come up with an alternative, less threatening interpretation of his or her experience. So quite nice there. He's done lots of work on health anxiety and other anxiety disorders, but panic obviously inclusive here. Now, Theory A, Theory B is our first cognitive strategy. So this is where we try and help people see things from a more helpful perspective. So hopefully part 1 helped you better understand the cycle of panic. So this can be half the battle actually in lots of cases. But how we reinforce this is through a strategy known as Theory A, Theory B. Now this is going to be a lot of information here, so hopefully it's not too much in one go. So this is essentially where we look at a hypothesis A versus hypothesis B. So let's take that example from part 1. So the individual who was fearful they were having a heart attack and would die. So that's Theory A, that's the problem there. His evidence or her evidence was that they had these symptoms. Their heart rate quickened, palpitations, dizziness, sweating, felt sick, having some chills, and their mind was racing. So what do they need to do if Theory A is true? In this case, he started avoiding exercise or stopped it right away. But also, if this were true, you're having a heart attack, you'll die, call an ambulance. You need some medical attention. And just to remind you, of course, this is where we're dealing with a psychological issue and that it's not a medical emergency. Now, what we want to do is think about the possibility that there's another theory here, another hypothesis. And this is Theory B. So Theory B essentially is the problem is that I fear I'm having a heart attack and will die. I'm worried I'm going to have a heart attack and I'm going to die. And now we start looking for evidence. So actually you can maybe start to think, when I worry, I kind of induce my symptoms. When I think about the symptoms, they might even get worse. And when I focus on them, it tends to exacerbate them. My doctor has reassured me my heart is fine. you could remind yourself this is acute anxiety, a panic attack. My symptoms may eventually subside. But also you might notice that when you're distracted, the panic goes away. And so if this is true, if theory B is true, what might we need to do? So these are some suggestions. Perhaps acknowledge the feelings. You might need to find new ways of soothing this threat system, this threat response that's been activated. But you might also want to reassure yourself that this will pass. So that's a cognitive strategy for it. So it's basically moving from theory A, which is threat-based, danger, danger, danger response, to theory B, which might reassure us that however unpleasant panic is, it's not actually dangerous, it's not actually going to hurt us. Of course, if you really had a heart problem, you need to go to a cardiologist. If the problem is psychological, then we can think our way through it and perhaps attend to different things. So there's lots of other different cognitive strategies: panic diaries, thought challenging, identifying and helpful patterns of thinking. And let's just expand upon that. So responding to these catastrophic thoughts, catastrophic interpretations of our bodily symptoms. So again, lots of information. Probably shouldn't do this. I'm breaking, the golden rule of PowerPoint because there's probably too much on the screen. But let's just talk through that. So, panicky thoughts, beliefs. I'm having a heart attack. What might a more helpful response be? Perhaps you could reassure yourself, I've had this feeling before. I know it's a panic attack. You might have a panic thought, I'm going to faint. And the response could be, well, actually, people having panic attacks are very unlikely to faint. So this is because when you faint, it's because your blood pressure is low. When you have a panic attack, your blood pressure spikes, so it actually goes up. So your blood pressure is higher, which means it's actually probably quite unlikely that you'll faint. But you might also have a panicky thought, I will lose control. A helpful or a more helpful response might be, a panic reaction is my survival response. So this is your threat system. It's designed to keep you safe, meaning it's probably quite unlikely you're going to lose control because your body wants to run away or wants to fight its way out. You might also think, I will embarrass myself. So this is a bit more of a social threat. So this is where, you might be worried about your public perception or how people are going to treat you, how people might judge you, etc. And a helpful response might be, when I've panicked before, people, even those close to me, haven't even noticed. Perhaps they're too busy with their own lives or what's going on for them. Stressful, busy lives going on. So people might not even notice what you're going through. And this is not to be callous or dismissive of other people, but just to remind yourself that actually maybe the social threat isn't actually quite as high as you might catastrophically believe. I am going crazy. Now, this is something people do sometimes think. They're going mad. They're going to lose it. And how do you reassure yourself? These feelings are panic. I'm not going crazy. So quite simple, but hopefully a little more helpful. So let's move on to the second stream of treatment. So this is where we focus on the body and think about how much we're hypervigilant about our bodily sensations, how much we selectively attend to our body. So here's a few ways of dealing with it. All of these are very easy to access through Google or whatever search engine you use. So body focus task, and I'm going to actually take us through that. But there might be relaxation exercises you want to use. Perhaps you engage in yoga or particular exercises that are stress relieving and actually quite good for you. And also attention training. So this is a really useful technique, the attention training technique, where we actually start to play with our attentional focus, and it can help with noticing how our attention can impact our bodily sensations. Now, mindfulness, of course, people probably are familiar with mindfulness. Sometimes people really struggle with mindfulness, to meditate, things like that. But it's just about attending, noticing what's going on. Definitely worth a go. If you found it hard, I think it's probably worth returning to, give it another go. And of course, exercise, goes without saying, it's sort of quite common sense, but the more we exercise, the more, it's good for our cardiovascular system. It relieves stress, it gives us endorphins, all these helpful kind of things. But the idea with this is essentially we don't want to go looking for trouble with our attention. If we attend to certain symptoms, it actually can exacerbate them. Now, I've included a couple of other techniques down here. The reason I've kind of separated them is I'm actually going to try and do another video about this, a shorter video, hopefully. So this is diaphragmatic breathing and also a range of grounding techniques. So I think that this will be helpful to work with as well. As I said, if you want to go away and do your own research, I think that would be very, very useful. Yes, and as I said, I'll hopefully do a nice short video, hopefully. Okay, so if you'd indulge me for a moment, I'd like to try a brief experiment with you. This is an attentional body focus experiment. So hopefully you're sat in a comfortable position, minimal distractions. I know you might be watching this or listening to this, so sit comfortably. You might even want to close your eyes if this feels comfortable for you. Now, when you're ready, I'd like you to focus your attention on a specific part of your body. Let's say your big toe on your right foot. So take a moment to notice what's going on. Think of some adjectives, some words to describe what you notice. Are there any sensations, perhaps vibrations, pulsing, any changes in temperature? What's happening right now your attention is zeroed in on that toe? Perhaps you've noticed something you didn't before. Maybe you've drawn a blank. Maybe there's no sensations there at all. Maybe you noticed changes once your focus was drawn here. So that's a very brief experiment there. But the aim of this is to demonstrate the power of our attention. Hopefully you noticed some changes there. So how an increase in our awareness of our bodily sensations might even exaggerate the intensity we feel these sensations. Now imagine you were feeling panicked and your attention gravitated towards your heart or your breathing. How might that impact those sensations? How might that make you feel? So just something to think about there. Now finally, wanted to talk to you a little bit about exposure. So this is our behavioural stream of treatment. So by challenging and changing our behaviours, we can really start to confront and face the fear of panic. So in our example earlier, the individual started avoiding exercise due to the fear of having a heart attack. So these sort of avoidant behaviours, along with escape and other safety behaviours, are totally understandable in the short term, but ultimately reinforce and keep panic going. So it can also fail to disconfirm our worst fear. And it also is actually quite corrosive when it comes to our appraisal of our ability to cope with these particular challenges. So just wanted to remind you, remember, a panic attack can't actually harm you. But what we want to do is start to expose ourselves to these situations in order to disconfirm certain unhelpful beliefs and thoughts. So when you feel you can confront these fears, it can be useful to draw up a list of situations you are currently avoiding because of panic or the threat of panic. So this is illustrated here by a ladder. So this is called an avoidance hierarchy. So essentially and this is our behavioural strategy, of course. So what we want to do here is make a list of the situations we're avoiding in terms of intensity. So there might be certain things you're avoiding, but it's not as big a deal. But there might be things you definitely want to avoid always because of the threat of it. So this can be something as simple everyday situations. For some people, it might be going to the supermarket on busy times. It could be taking the longest route of your journey to avoid going on a busy packed tube, perhaps at rush hour. So perhaps you identify with the example we used earlier and avoid exercise when your heart starts racing. Avoid exercise altogether. Perhaps it's more of a social threat. Maybe it's hard to ask questions in seminars, share your opinion. Maybe you don't like social groups, or you have some performance-related anxiety presentations such as this. And what we want to do with this hierarchy is I guess, rate what the extent of the anxiety or the panic is. So there's going to be certain situations that are more stressful, more difficult. Perhaps it's 100%. You never really want to do that because of the intensity of the feeling. It could be 80%, 50%, 30%. The idea with this is that we want to start to think about how we grade our exposure in order to put ourselves in these situations. So try not to judge yourself too much for these avoidant behaviours. We all have things that scare us. but try and be honest enough with yourself to contemplate what you'd like to start changing. So that's why we rate these situations, because we can maybe start to think about how we can dip our toes in the water and start to gradually, in a graded manner, expose ourselves to these situations. Exposure's got a really good evidence-based track record for helping people overcome panic and their anxieties. Start where you can and try to commit to some behavioural change and experimentation. Now, what do we do after we've put ourselves in these situations? We want to reflect on it. We want to think about what we've learned. Think about, did the worst thing happen? Did the results of the exposure experiment support theory A or theory B, going back to our cognitive strategy earlier? How well did you cope? Think about what went well. We want this to be a win-win. Essentially, we want to look at it and take the positives from it. Perhaps it's good that you've just put yourself in the situation. Perhaps you've avoided it for a long time. So that's actually remarkable in itself. Think about how you feel about other people who face their own fears. Do you respect them, admire them? Do you give them credit? So if so, give yourself some credit. At the end of the day, you're going to feel anxious putting yourselves in these situations. You're going to feel panicky. But it might be worth trying again to the point where you start to feel more comfortable, or until you truly start to believe you can cope and that there's no danger present. So to summarise, what we've looked through here is a three-pronged attack when it comes to panic. So through our cognitive restructuring, using our theory A, theory B, or using responses, challenges to catastrophic cognitions and difficult beliefs that pop up during challenging moments. So this alters our perspectives, hopefully reframes how we perceive and how we relate to panic. We've talked very briefly, admittedly, about how we retrain our attention. So this is where we start to notice how we connect with our bodily sensations, but also how we engage with the body through relaxation techniques, exercise, simple things like that. And then thirdly, of course, we've talked really briefly through exposure. So this is where we face panic-inducing situations, reduce, but ultimately, hopefully, drop escaping, safety and avoidant behaviours. So that concludes part 2. It's another non-exhaustive presentation on how to cope with panic. I would thoroughly recommend you do your own research into how to cope. We all have our own ways of dealing with life challenges. I hope you enjoyed this. I hope it was useful in some manner. Good luck with coping with panic. Stay safe. Take care.